Horizons, where each week we share the latest news and research on trauma informed care, positive and adverse childhood experiences, and psychological safety. I'm Alison Cebulla.
And good morning, everyone, or wherever you are in the world. I'm Donielle Prince, and I'm just subbing for Bree Twombly today. I'm an advisor to 10 Collective, and I support 10 because their team is creating a world where people genuinely care for one another. So we hope that you'll consider hiring 10 to implement trauma-informed care and psychological safety-based programs and policies to better care for your employees and, in turn, for the communities you serve.
Thanks, Donielle. I was trying to figure out how to share it to my personal LinkedIn, and then the audio came in. So that was what that was. So sorry about that. Still figuring it out, everyone. um, so today is Thursday, April 11th, 2024. And yeah, let's get into it. Just as a heads up, the stuff that we talk about involves trauma and sometimes violence.
Okay. So are we diving in?
We're diving in. Go for it, Donielle.
Okay. Well, one of the first pieces in the area of trauma-informed care, in Maryland, in Prince George's County Public Schools, there's a nonprofit supporting the hiring of social workers in an initiative to bring trauma-informed training and counseling to that school district. So I'll just read the main focus of the initiative. Um, During the grant period, Paths for Families will provide specialized evidence-based counseling to high school students currently experiencing foster care or living with a guardian or adoptive parent. Monthly support sessions for caregivers will also be offered. And additionally, trauma-informed care training and coaching will be facilitated with staff from all 33 high schools in the county. The grant is timely as a recent needs assessment for the school district revealed that about 1/3 of students feel they can't access behavioral health services if they need assistance. And so I shared all those pieces because I was just sort of like, wow, 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 as I went through. Um, it's a great sign that they're not just looking at the youth themselves, which is critically important, but they're also investing in training the staff and the caregivers, because you need that holistic. If you're going to support youth, you have to support the people who are in regular contact with them and help them become better supporters as well. So what a well thought out initiative is what my initial reaction was to that.
Yeah, absolutely. Although, yeah, it's interesting. Like sometimes the dollar amounts, I'm always like, oh, it's like $700,000.
True.
That seems like a good amount, but of course we know it's, I don't how far is that going to go? But you're right. I think it seems like a really wonderful, well-rounded initiative.
Yeah, the training part, I guess you can always use upgrades on your training, but at least when you have the training now, you have the knowledge and kind of the perspective shift. But the ongoing access to the counseling, um, yeah, hopefully they will continue to find sources of funding, because that is, um, it's I think, as we all know who are interested in this topic, there's a terrible shortage, a workforce problem, and when it comes to accessing mental health services. So um, that's going to continue to be a problem for a long time, because even as we're trying to work on those workforce issues, they can't be solved immediately. There's a whole training pipeline. So being able to make sure that these youth have access to counselors is great, and I hope they can keep it up.
Yeah, absolutely.
And so let's see what's next up. Um, the it's called it's called NCA STAR, which is a great name, North Carolina Academy for Stress, Trauma, and Resilience. And so this is located at the University of North Carolina, Greensboro. And this is great to see that a university, and I'm sure this is being replicated in other universities as well, but they're offering their own online certificate courses for two groups of youth serving professionals, K through 12 educators and mental health professionals. And so you could take either track. And I was just kind of reading about what they're offering, and I'm thinking it's great that there are more options for professionals in these fields to take a deep dive on understanding stress, trauma, and resilience. Um, and this is especially helpful for non-traditional mental health professionals who might not have ever taken coursework in trauma. The way someone, a mental health clinician with counseling training, would have had that as part of their degree program. But if you are um, entering the counseling field by another path, you might not have had that opportunity. So I thought that was a great catch on the part of UNC. And then educators, there's a lot out there now where schools and school districts can contract and do whole school, whole district trauma informed work. But I think there's also, I don't know what the numbers are, but I think there's also just as many schools out there who aren't doing anything. So if you're a K through 12 educator, you can find this resource and start to gather that knowledge on your own. So I think it's great that UNC is making that possible.
Yeah, and we were saying we would love to see it be maybe more of like a required curriculum rather than an optional certificate at some point in the future, right?
Well, yeah, I think that's interestingly, it's changing when people go down that traditional path. But where I think it's for at least for the mental health professionals, but when it comes to the educators, yeah, I would love to see more districts adopt use some of their resources to create more. There's a lot of different terms, but we could go with the term trauma sensitive schools and do it as a whole district,
Yeah.
whole school approach. And it's so great that there's an individual motivated educator who is going to show up in their school and maybe even act as a champion for trauma informed education. But it's the commitment level being at the system level would be really important.
Yeah. And we comment a lot at Tend Collective about how every time that you put the onus on the individual to change, like, oh, the educator can learn more and change. This is just not going to be the kind of systems wide change that we really need to see. And you're kind of sometimes like adding an extra load on, for that one person, in this case, an educator. So love to see these kinds of interventions, but for us, what we're critically thinking about is, but how could the whole system be trauma informed rather than asking kind of the end user to be the one who changes?
That is a really critical perspective shift. Yeah. Um, so let's see. Um, this is kind of the last item that under trauma informed care that we have for you today. So this one is Twin Cities United Way. Oh, that's great. United Way is helping to promote trauma sensitive care. Um, and so this well, it's great to see the philanthropy sector engaged in expanding trauma-informed practice among their grantees, because that's a really important, you bring grantees together, you can really influence change that way. So the Twin Cities United Way has the Greater Twin Cities United Way 80 by 3 initiative. And so this initiative is convened as a network and it's collaborative based to help each of the grantees have the training and resources they need to begin to think through how to address healing, treating, and preventing ACEs in their local area. And it is specifically focused on early childhood. So grantees whose work focuses around early childhood. So that's great to see that expanding. I think there's a lot of efforts like that around the country now, and every time a new one pops up, that's encouraging.
And for those who aren't familiar with all of the geographical lingo, the Twin Cities are in Minnesota.
Yeah.
Right. There's so many like Twin Cities, Tri Cities, Triangle.
That's true.
But yeah, United Way has been doing a lot of work all over in trauma informed care. So that's really exciting because it's like they're already set up to do good work. So the fact that they're taking this on, I think, is really remarkable.
Yeah.
So, moving on to ACEs, adverse childhood experiences news. Um, there is a study from the Journal of Child Abuse and Neglect that came out March of 2024. Adverse childhood experience and young adults problematic internet use, the role of hostility and loneliness. This is something I maybe haven't seen a whole lot of conversation about, so I was curious about it. Um, there have not been that many studies that have looked at the relationship between ACEs and what they're calling in this study problematic internet use, PIU, during young adulthood. And so I was really curious as to what problematic internet use encompassed. And so it is defined as the use of internet that creates psychological, social, school, and or work difficulties in a person's life. It envelops a wide range of activities, including video gaming, social media use, web streaming, pornography viewing, and buying. So the study was using data from the Taiwan Youth Project from 2011 to 2017, and the sample included 1,885 participants with the median age of 31.3 years. And so what they found looking at this data was that ACEs and so again, adverse childhood experiences encompass stressful things that happen in childhood, such as abuse or neglect, or parents suffering from mental illness or substance use, or not being present. And so what they found was that these ACEs were associated with hostility and loneliness, emotional and social, and that this was then also associated with this problematic internet use. And so for me, even though this study was looking at a population in Taiwan, and I don't know what their gun policies are in Taiwan, but I haven't seen any school shooting news from Taiwan. But when you take this same idea of problematic internet use and ACEs and you look at the US, you're introducing guns into the conversation. And so it made me really, really curious about school shooters who are often spending a lot of time online researching violence and guns and talking about their plans in online forums. And so I feel like introducing ACEs into the conversation when we think about school shooting and school violence prevention could be really valuable. So I'd love to see some US researchers reference this study and kind of maybe look at some of the violence that we're seeing in the United States that is particularly deadly.
It does seem like a very noticing that's in the Journal of Child Abuse and Neglect, and to as I was listening to your description, to it makes sense to conceptualize, our responsibilities, any type of adult stakeholder in a child's life, our responsibility to address connection and ensure and find ways that whether we're interacting as a caregiver or interacting in as teachers or other kind of youth serving professionals, that we are focused on creating connection. And this research just kind of highlights it, and just both the topic of the research, the connection between hostility and loneliness, and
Yeah.
also it's showing up in a in child abuse and neglect journal. I feel like it's really well situated. This is taking good care of children is ensuring that they have quality connection. And this study just kind of affirms that.
Absolutely. Yeah. And all of these studies and pieces that we're referencing will be listed on our website. We have a post for each week that we do this that lists everything that we're referencing. So we encourage you to check it out more in depth. So there's another study here from the Journal of Nursing Education, April 2024. This was a project called The Faces of ACEs, Case Studies for Teaching About Adverse Childhood Experiences. And so this was developed to present ACEs in a psychiatric nursing course in a baccalaureate nursing program. And it was created as a senior honors project. So two senior nursing students who had learned about ACEs in their psychiatric nursing course worked together to develop a strategy that would supplement the material they were learning in class. So they teamed up with faculty and developed 8 fictional case studies And these fictional patients like have a name and a photograph of not, not the actual person. And so then the patient's story is presented, and so it's just they're describing their childhood and a description of the ACEs, and then their adult life and physical and behavioral health outcomes. Um, and then um, students can be asked to determine an ACE score um, in the psychiatric nursing course. So, students have reported that they have greater empathy for patients they have cared for in the clinical setting who have a history of childhood trauma. And so the students reported that they felt that this was a beneficial discussion. So what this makes me think of is a few things. So one, I have personally worked with training nursing students before, and they really aren't getting ACEs as part of their curriculum. They're also not really getting soft skills. Like a question that I heard come up a lot is like, we don't know how to have hard conversations. Like helping these people is really hard. Like these are some really tough things that come up around health, life, death. And we don't have the skills to do that. So I think it's so wonderful to introduce these kinds of programs. And especially I like that the nursing students themselves came up with it. I always think it's so nice to actually involve the population that you're serving in creating their own interventions. However, I do have some concerns about trying to find out someone's ACEs score. And I think that's like a really complex issue because some people will say, oh, I have 9 ACEs or I have 10 ACEs or I have 1. But the problem with that original ACEs study is that knowing your score can really only go so far. It really should just be like the very first possible entry point into understanding childhood trauma and toxic stress. But it shouldn't be like the end all be all because someone may have had the same ACE as you, but they may have endured it in a way that was more intense or longer duration over time. And so you can't really compare. It's like comparing apples to oranges of saying, oh, well, these two people have an ACEs score of 4. At a population level, the original ACEs study was really beneficial to say, wow, what we noticed when we looked at 17,000 people is is that people who had 6 or more ACEs were more likely to prematurely die about 20 years sooner on average, which right, that was the huge thing that part of the original study that showed. But that's a huge population to look at. And so between individuals, I don't think that knowing someone's ACEs score is necessarily that useful on an individual level. What do you think, Donielle?
Well, yeah, I think the literature is moving in the direction that you just described, and I'm recognizing that when it comes to this specific exercise that was being done, the faces of ACEs, it's it's one training tool in medicine, in the health field in general, is case-based learning. And so, the idea is, okay, um, you're preparing people for practice. How do you take the things they're learning in textbooks and help them start to think about how they're going to apply it? And of course, in the medical field, they're going to work in hospitals. They're going to actually, they're going to train. They're going to train in the practicum style. That's the word I know from counseling is practicum.
Yeah.
They have their own practice-based way of learning, but this is sort of case-based learning as a bridge. So it's interesting to see that tool, which is usually used to help um, uh, people who are being trained in medicine understand, uh, start to practice the skill of like, what might be, what are the symptoms I'm noticing, and what are the solutions that I should propose. So to take ACEs and put it in that and use it as a teaching tool in that manner, I think that I get the idea, and as we're trying to get medical providers to be more involved in thinking through how the emotional experiences that patients have are relevant to their health, it makes sense that that's going to show up in case-based learning. But I think for the reasons that you just shared, Alison, uh, it might need a little bit more brainstorming to be more current with what the literature says about, like, we probably wouldn't be, I can't invent or the idea, the new kind of case. So I would encourage using cases on kind of these emotional and psychological symptoms that patients have, but maybe it wouldn't be trying to identify their ACE score, but maybe something more like, just off the top of my head, just learning how to ask, like, to use your point when they said we don't know how to have hard conversations like that. So maybe the case-based learning is about practicing the skill of asking these questions in an empathetic way, and
Mhm.
feeling more confident, so that, the outcome of the case-based learning would be, I feel a lot more confident asking my patients about uh, things that might be going on in their lives, and seeing that as relevant to my care. So we're not going to reinvent the tool. I think the idea of bringing that into medical training is great, but I don't know. I think I agree with you that I'm not sure actually how helpful identifying the ACE score is ultimately going to be for the purposes of helping them figure out how they're going to use it in their actual practice.
Absolutely. And then, one thing I keep hearing when we look at ACEs interventions such as screening is like, oh, well, like it's increasing empathy of the care providers, the healthcare providers toward their patients. And I love the idea of increasing empathy and compassion. I love that. But it does feel a little invasive. Like you shouldn't need to know what trauma happened to someone or what their ACEs score is to be able to empathize or to know that they experienced something difficult. And so I would love for ACEs and trauma-informed education in like nursing and medical education to form a foundation of like these things, just assume they happen to someone that you're providing care to. You don't necessarily, maybe it could be helpful, but you don't necessarily need to know, but you should like know it in general, but maybe, you don't need to know about the individual in your office, exactly what happened.
Yeah.
So there's another study here in the Journal of Crime and Delinquency 2024. The link between adverse childhood experiences and mental health in offenders, a systematic review. And so we love to see systematic reviews where we're looking at all of the literature. They looked at 12 scientific articles. Where ACEs affect the offender's mental health and criminal behavior, and results demonstrate that physical abuse, emotional abuse, the death or incarceration of a parent, physical or sexual abuse are the most frequent ACEs identified by criminal offenders. And ACEs are expected within, oh, that's interesting that it says that. ACEs are expected within the offender population. um, um, I wonder, that's such a funny thing to say. Right? Compared to general populations, more ACE experiences and a higher total number of maltreatments are evidenced in individuals who have committed a crime. Studies have revealed that the presence of ACEs differs according to gender and the type of offense. So, neglect, verbal and physical abuse, and a family member in incarceration were significantly more likely to be reported for men. And in contrast, women often reported more sexual abuse and mental illness in the household. So that's interesting. So I feel that this is such an important conversation to be having about criminal justice because we do want to think more compassionately. I mean, when I think about criminal justice in the United States, it's more like criminal injustice. I think the entire system that we've built is part of the kind of capitalist machine that's really taking advantage of people and offering punitive solutions at every turn and trying to incarcerate as many people as possible for profit. So I think it's a huge problem to solve, and it has very cultural roots in terms of how we think about people and why someone and what we even consider to be a crime. Um, but I think that it is really important to be having these conversations about linking toxic stress in childhood with potential, of committing of crimes and incarceration in adulthood, because this eventually will lead to, I hope, um, less incarceration. What do you think, Donielle?
Well, it's an interesting article because what it does is it kind of adds to, I guess, the knowledge base was a review. So it's adding to analysis and understanding of the mental health status of incarcerated people. Um, and it's good to have research that kind of backs up these ideas. I think there's been a conversation for a while about how um, we can see that our disinvestment as a society in mental, behavioral, and social services is connected to a rise in incarceration, to the point where some writers talk about how I mean, there's a phrase that's often used around the Los Angeles City Jail is the largest mental health um, hospital in the nation. So
Mm,
so this
mhm.
idea is out there already that without even using ACEs, idea that who you have in who we are incarcerating in this country are people whose mental health needs aren't being met. And I think an extension of that, and it could be an mostly and, we'll say and, or it might be a mostly and, but also their social needs aren't being met. So instead of using our funding for social, mental, and behavioral health services, we're building prisons and not providing people any of those services. And then
Right.
that's who ends up being incarcerated. And then ironically, there's that I'm probably going to forget. It's such a great book. Oh, Just Mercy by Brian Stevenson, where he is talking to one of his clients, and the client actually says, I didn't start getting any help for these problems I'm having till I got to prison.
Right.
So
Right. Right.
I know that, like, the if you want to talk about incarcerated folks and what it means um, to prevent ACEs, or the importance of preventing ACEs, is that people are actually getting their needs met, and they don't have to go to this carceral institution in order to get their needs met. So that's been a conversation for a while. And so every time there's a piece of academic evidence that helps contribute to that conversation, that's always valuable. So people who are having that conversation and trying to use it to shift policy around incarceration and policy around increasing access to mental, behavioral, and social services, this would be something that could be cited
Yeah,
to bolster that conversation.
absolutely. Thanks, Danielle. So, our last piece that we're going to talk about today is from the Healthcare Management Review. And this is in the area of psychological safety. This was published in their April 2024 journal. System justification theory as a foundation for understanding relations among toxic healthcare workplaces, bullying, and psychological safety. And of course, this caught my eye because I just feel that there's so much in the news lately about toxic healthcare workplaces. It's just actually a huge, huge epidemic. Um, and so I hadn't heard of this system justification theory before. Um, so system justification theory posits that people are motivated to justify the systems with which they are embedded, even if those systems are dysfunctional or unfair, which is interesting. And this, by the way, was done by an investigator at Cleveland State University. And the team found that let's see. So it was a cross sectional survey of healthcare workers, 302 healthcare workers. Um, and they were looking at negative relations between instrumental climate and psychological safety. So, because of this thing they're calling system justification, the instrumental climate no longer had a direct negative association with psychological safety. Bullying was found to play a moderating role in the instrumental climate and systems justification relationship, which is very jargony. Yeah. Um, I think um, so. They're saying, I think what they're saying is they found that that systems justification was a part of the toxic workplace environment in the end. Um, and so it's saying some scholars have proposed that a focus on disrupting workplace contexts that trigger systems justifications in workers could help break patterns of behavior that enable toxic work environments and bullying to persist. And so, despite all the jargon, I think what it's really saying is we have to have a better understanding of the justifications that people use to perpetuate systems that are dysfunctional and toxic. So, we have to be able to go in and say, okay, but this bias is already here. You're already going to justify the dysfunction because it already exists. And so we need to know that already and start from that place. Is that kind of what you're thinking, Donielle?
Yeah, and it's an interesting study and approach to trying to understand kind of the specific lever in a workplace that triggers sort of that human behavior of safety seeking. So the human behavior of I'm going to do what it takes to survive because I need this job,
Yeah.
essentially.
Yeah.
And then finding some evidence that if um, you're able to help people maintain a sense of what's just and not just outside. That's a hard task, and so it'd be interesting to see how this plays out in practice to get people to think like, right is right, wrong is wrong, outside of their sense of what they need to be safe and get their needs met at work, and in terms of what work means for their safety and stability outside of work. It is really interesting. It seems promising that interventions could be developed from here. And the other thing that I took from it was we don't have social policy that protects people from bullying in most states. Like, we have something around harassment that's not just sexual harassment in California, but I don't think that's in all states. So but bullying is a whole other thing, and certainly unhealthy workplaces. And I think I'm not an expert on this part, but I think there are other countries, I think in the UK, where there's at least something
Mm-hmm,
um,
mm-hmm.
that suggests that something in policy that helps protect people against bullying. And how effective that is, since it's such it's like intimate partner violence, it's such an intimate
Yeah.
experience, it's hard to prove. But at least
Right.
it's there. There's an institutional uh, there's an institutional statement against it, and we don't have anything like that in the States. So it's great to see this kind of research because it helps us figure out how to have that conversation.
Absolutely. The other thing it was making me think of is that, because I was thinking like, oh, it reminds me of all the heuristics and cognitive biases. And then I remembered that this was a current event that Daniel Kahneman, who was the one that did all the research on these cognitive biases, passed away on March 27th, 2024. So just a couple weeks ago at the age of 90. And how much his work enabled us to go, oh, well, that's confirmation bias. So, starting from that place, how can we understand how the brain works more? And so with this systems justification theory, it feels to me like something where we could say, oh, that's like you're doing that systems justification thing in like an organizational, rather than it being like within the brain. Like, what are the
Yeah,
biases and heuristics within a organizational structure that we could say, oh, well, you're implementing this bias, and then if that could help us make change quicker in the future.
yeah. Not to quote cartoons, but sometimes knowing is half the battle. Being able to label the behavior is
Exactly.
it can help a lot. Mhm.
Exactly. So thank you all for tuning in live. And this was our second ever news segment. So thanks for being here from the beginning and learning along with us. And we will see you next week.
Okay, I'll be in the audience with you next week.
Okay, great.